South Africa spends more money on cancer treatment than it should. That's according to medical researchers. A BMC Health Services Research Journal study found that the country's health system spent more than 90 million rand on treatment that could have rather been diverted to preventing the disease. For more on this, we're joined by the South African Medical Research Council specialist scientist, Dr. Karadi Wright. It's great to have you with us, Doctor, this morning. Firstly, perhaps let's just begin with the findings of the survey. What exactly were you looking into here?
Thanks. So this study, we were focusing on skin cancer, and we were trying to put a cost to what that would cost South Africa in terms of the treatment, the diagnosis and the treatment of skin cancer. And that's both non-melanoma, which is not fatal but disfiguring, and melanoma, which can be fatal if it's not treated early.
Much of this spending on treatment is misplaced. Why do you think that is?
Because one of the main risk factors for skin cancer, in other words, one of the things that leads someone to get skin cancer, is overexposure to the sun. So if we were to protect our skin better and not have blistering sunburns, for example, or intense doses of sun, the likelihood of getting skin cancer could be reduced.
In terms of the actual study itself, if a government were to try and divert these funds, as you've alluded to there, where would they be spending the money in prevention? What would they need to be doing?
Right, so most countries around the world, when they focus on skin cancer prevention, they have multi-component campaigns, but there would be a large focus on schools, so trying to encourage school children and children from a young age to adopt healthy sun behaviors. And the other one would be in the occupational setting, so in workplaces, ensuring that people who spend a lot of time outdoors are protected from the sun.
You talk about also setting a new agenda in your study. That's, of course, the message to health officials. How big a problem is skin cancer in South Africa?
Skin cancers account for about 1/3 of all cancers in the country. So those would include things like prostate, cervical cancer, lung cancer. So about 1/3 of all the cancers diagnosed overall are skin cancer related. And so that's a significant problem. If we were to spend money educating people and raising awareness about preventing skin cancer through protection of the skin from the sun, we could reduce that cost and that burden to the country and divert the funds elsewhere.
And when we talk about prevention also, one of the things that automatically comes to mind, is using more sunscreen. I mean, is it really as basic and simplistic as that?
It can be, yes. And in fact, even better than sunscreen. Obviously, sunscreen is great when you have to be outdoors, but find shade and wear a hat. And think about what time is best to go outside, so not around the midday hours.
All right. What are you going to be doing with the findings of the study from here on?
We'd really like to use the findings of the study to encourage more awareness and efforts around skin cancer prevention. So we want to raise the level of effort that goes into prevention of skin cancer rather than the treatment and diagnosis costs.
All right, that's where we'll leave it for this morning. Dr. Karadi Wright, she's a specialist scientist at the South African Medical Research Council.